Karl Bremer is one of the district hospitals, which is a level 1 hospital, but they do a lot of extended functions for secondary hospitals because we've got fewer beds this side. They refer to Tigerberg. And we have seen that in the EC, which is the emergency care, there is a lot of service pressure where you get even more than 100% in terms of the bed occupancies. And also lastly about the issue of now people coming in with more than one form of disease. It creates a lot of pressure because in some of the conditions in the EC, they're not supposed to be there, they're supposed to be referred. But you have seen some patients can even wait for 1 or 2 days waiting for a bed, but they've been seen, but they're being made comfortable. So I think we need to appreciate and acknowledge the resilience of the staff under such conditions of having such a service pressure where people get ill.
It can be a war zone just about any time of the week. We have a large volume of patients that attend just about any day of the week. We have a lot of people who need the services of the government healthcare, and we really do the very best we can to try and meet their needs on a daily basis. It's sometimes very challenging.
Providing healthcare to a general population is challenging, and providing emergency care is particularly challenging for a number of reasons. The first one is unpredictable. So you never know how many people, when, and with what problems are going to come through your door. So you have to be over-prepared all the time. In our context, being over-prepared is still under-prepared because there's a fundamental supply-demand mismatch in healthcare, not only here but everywhere. If you go to Hong Kong, Kinshasa, New York, Geneva, it doesn't matter, it's overcrowded everywhere. So setting up a system where you can sustainably provide high-impact care in such an unpredictable and overburdened environment can be very difficult. No one person can do it. Dr. Louis referred earlier to a team, and it is the quintessential team sport. You have to select the right people for your team, you have to train together, you have to work together, you have to trust each other, you have to know that the other guy has my back and I have his back, because it's an incredibly high pressure environment.
What happens in these areas, especially in the areas like the EC, it's a manifestation of what is happening outside. Whilst we as the department are responsible for the health services, but the health is everybody's business. So the manifestation is when, for example, during the end of the month, the paid days, during the weekends, you see a lot of older people who are being brought here with difficulties in breathing and all of those. And in most instances, you find that some of them are neglected. You also see some children also come through as an emergency, and you find that they end up being an emergency, whereas probably like the issues about the asthma, taking the treatment, supposed to have been taken care of at home. So this is a reflection on what is happening in the society. It's supposed to be a whole society where we work together in terms of the preventive and promotive, because we'll never be able to keep on mopping the floor, yet we have to close the taps at the community level.